So we've already done a DEXYCU video on a straightforward cases. Here's a couple cases that aren't quite as straightforward. So again, when we go in, the eye's overinflated. I'm going to try to put this DEXYCU suspension kind of more inferior. Here I'm tucking it right near the haptic. We're going to inject, and immediately you can see that little air bubble, and the air bubble is going to be just suck some of that medicine right into it, and I kind of don't want that floating around if it doesn't have to be. The rest of that bolus looks kind of in a nice position. So all we're going to do is bring in the cannula. We're going to very carefully kind of decompress that bubble and bring it right back out of the eye. And once that's done, I'm going to gently rehydrate the wound just to keep that pressure up. We're going to do it very, very carefully so we don't displace any more of that DEXYCU suspension. And once it's adequately rehydrated, we're going to be done. So a second case, again, eye is a little overinflated just to provide stability. We're going to come in here. Our goal is to inject this kind of in that inferior nasal location. Here we're going right underneath that capsule, right into the bag. Again, same location, but this time it's kind of moved a little bit more central, and so you could probably actually leave it in a position like this, but that DEXYCU can leave a little bit of a film on the IOL. So instead of doing that, I'm going to try to just use a BSS solution and push that DEXYCU or kind of roll it off of the lens just with BSS. And so that's a nice example of rolling off the DEXYCU with BSS right back into the capsule right near the edge of the IOL. It's a little bit larger of a DEXYCU ball than what you probably need, and so I'm going to go in and just try to remove just a little bit of it, again very carefully with the goal not to displace it or move it around. You could have also probably just left that amount of DEXYCU inside of the eye and not had any problems at all. So another one, again, eyes overinflated. We're going to bring in this cannula. We're going to bring it right into the bag, right under the capsule there, right near the edge of this optic. Again, large bubble. It's wanting to move more centrally. It's continuing to go. It's kind of moving quick enough that I am unable to roll it under before it's completely moved out. And so in a situation like this, probably best not to leave it just centralized like that. An easier thing to do, you can see me doing here, I'm just reinflating the eye first. I want to get overpressurized before I mess around with this thing. Then I'm going to go in there with that cannula, and I'm actually just going to suck out the DEXYCU entirely and redo the entire injection. So the DEXYCU is out now. I'm just kind of clearing the cannula to get back to just straight medicine. I'm going to, again, reinflate the eye because I do want it a little overinflated. I'm going to tighten up my wound a little bit with BSS. And here we're going back in with the DEXYCU, again, underneath, in the bag. Nice injection that time, a little bit of DEXYCU medicine kind of sitting more centrally there, but it's not a lot, probably not worth chasing. I'm just going to leave it alone, and that should just settle off all on its own. So another one here, again, very repetitive. We overinflated the eye. We're going to go right underneath the capsule to the edge of that haptic. We're going to let it go. Whoop! Unable to pull it out without losing a little bit of it. And here, I'm trying to just inject a little bit more. I was debating just leaving those two little balls in place, but now that I have 3 of them in there, sometimes it's a little bit easier, instead of chasing them around with the BSS cannula, to just go straight in there with the IA, suck everything out, and just restart from the beginning. So here I'm going to bring in the IA. I'm just going to get rid of both those balls real quick. We're going to come back out, we're going to rehydrate the wounds, overinflate the eye, and then reinsert that DEXYCU. Or I guess in this case, I'm just going straight to the DEXYCU. I'm going right in the capsule, right on the edge of that IOL. We're going to do a nice injection, pull it out quickly, and there you go. Nice deposit of DEXYCU right in the corner of the eye. Thanks for watching this video.